good afternoon, and welcome. My name is Lucy Aquino, and I'm the Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center. And today, we have a live interactive show. The phone number is 738-1060, area code 312, and that number is at the bottom of your screen. If you have questions during the show, please feel free to give us a call. Today's topic is going to be fecal incontinence. And this is something that we invite you to call in, as I said. Have questions, please ask. Joining me today is Dr. Joaquin Estrada. Dr. Estrada, thank you for being on the show.
Thank you for having me.
Thank you. And Dr. Estrada is a board-certified colon and rectal surgeon affiliated with Advocate Illinois Masonic Medical Center. So, Dr. Estrada, I know that fecal incontinence is an inability to control bowel movements, causing stool or feces to leak unexpectedly from the rectum, so also called bowel incontinence or fecal incontinence. But Dr. Estrada, why this topic and the importance of it, and what exactly is fecal incontinence?
So that's an excellent question. Thank you for asking. Fecal incontinence is one of those things that we often don't want to talk about. It's not something that you necessarily talk about at the dinner table, but it's very, very common. When you combine all forms of incontinence, and those are accidents either related to the bowel or the bladder, it's as common or more common than diabetes. Mm-hmm. Extremely common. I'm sure many of our viewers can count on their hand how many people they know have diabetes, if not as many people have issues with their bowels. It's extremely common, but the problem is most people don't feel comfortable talking about it. And today, what I hope to do is start a dialogue so that people are more comfortable talking about issues that can be very easily fixed. Your first question is, what is it? It can be something as simple as the uncontrolled accidents that might occur from the bowels leaking out of the body. It could be just simple moisture. It can be less confidence or even urgency, the need to run to the restroom, but you're never actually soiling yourself. It means a lot of different things to a lot of different people. But the good news is there's a lot of good options that we can do that are not invasive, oftentimes treated simply with just a conversation with your doctor or dietary measures.
And that's really the most important, especially that conversation with your physician. So who's really at risk for fecal incontinence?
So everybody can be at risk. You can imagine that fecal incontinence is an inability to keep things in place, whether keep the stool in the body, and so that's reliant on a muscle. That muscle has to stay toned. Over time, muscles in our body can get weaker as we get older. So patients that are of advanced age. Female patients are also at risk of having issues with incontinence, largely because they have less muscle in that area to keep it in place. More importantly, though, that many female patients have a history of pregnancy and vaginal delivery. And 30% of all vaginal deliveries actually result in a break in the muscle, so much so that over time, they're at risk of having these issues. Diabetics are also a very common patient population that is affected with it. Many diabetics have neuropathies, and neuropathies are inability to fill either at their feet or on their legs. That same inability to fill along those nerves can affect the control of the bowels. But those are the most common groups of people that are affected by it.
So are there symptoms to this? I mean, you mentioned some of them. Is there anything else that's significant? Or, I mean, I can see people who've actually, when we've had this type of discussion, will say, you know, sometimes, Lucy, I eat something and whether it's a restaurant or a certain food or a certain spice, and all of a sudden my stomach is just so upset that I have to get out of there.
Yeah, and so a lot of the symptoms are very specific to that patient. Many patients will try to treat this themselves. So they'll avoid certain things. Maybe caffeine makes them really have to go, or spicy food. And so they'll start avoiding some of those things that they like so that they don't have those unpleasant reactions. Maybe if they do go out, they will know every clean restroom along the way. So they map out their journey before they go. So If they do make it to the restaurant, they're going to want to sit, a lot of the patients will want to sit near a restroom, so if they do have to have an issue, they can rush right off to the restroom. So those are some subtle things that a lot of us might be experiencing, or a lot of our patients might be experiencing, but we kind of downplay and say, oh, you know, it's normal, it's me getting older, or this is part of aging. But the really important thing is that this is not part of aging. This is something that we can help you, and we can help you with very easily.
So is this something that's diagnosable?
Yeah, so there's a lot of things. So if you are one of the patients that are brave enough to bring this up to your doctor, then they will often enlist a couple of tests that can be done to help figure out what the cause of the problem is. Because as I mentioned before, sometimes the cause is related to the muscle itself, and the muscle's not intact. So you can think of the muscle in that area as a circle, and if it's circular, it can close very easily. And if that circle is cut or impaired, it won't close as tight, in which case you'll have more likely to have leakage. So there's a very non-invasive test that can be done to check to see if the muscle is intact, or the integrity of the muscle is the way we'd expect it. There are other tests that we can do that can be done to check how strong that squeeze of the muscle is, and see how the nerve is communicating with the muscle and the colon and the rectum. All these tests can be done without changing your medications, without having to have a ride home, without having to take a big bowel prep that many people worry about for colonoscopies. These can be done very easily, and the tests can take roughly about 15 to 20 minutes. So it's very easy, very safe, and doesn't cause any harm to the patient.
Wow. Again, I want to remind our viewers that our lines are open, and you're watching Can Cable 21. And today we're talking with Dr. Joaquin Estrada of Advocate Illinois Masonic Medical Center, and we're talking about fecal incontinence. Our phone lines are open. Area code 312-738-1060. If you have any questions for the doctor or myself, please give us a call. Lines are open. So, doctor, you mentioned that there is a way of diagnosing it, and how is it treated? I mean, usually if there's if patients are going through this, and a lot of times, and you're right, as you said, sometimes they won't discuss it with their physician, worried about potential treatments. But if they were diagnosed with this, how is it treated? So,
a lot of the patients don't have various reasons for not bringing it up to their doctor, but one of the most common reasons is that they say, oh, I'm too old, or there's nothing that can be done. And I'm glad that, Lucy, you've invited me on today to kind of discuss that, because there is a lot of things that can be done when it comes to these issues. The first and foremost thing is to just try to identify which foods are more likely to have you cause issues. So there's a very generic way to think about it. Anything that stimulates the bowels to go faster will likely put more pressure on that muscle to work, to do its job. So we'll often ask the patients to keep a diary of their foods and see what they're eating and see if there's any triggers. But if the most common triggers are, unfortunately, all the best things in the world. So caffeine, chocolate, cheese, spicy food, citrus, and beer.
What am I supposed to eat and drink that?
Yeah, exactly, right? Yeah, so that, I think I had that for lunch. So, except for the beer, of course. But no, the reality is all those things kind of creep into our diet, and it's very easy to be affected by the diet. But one of the very first things that we'll ask that you do is to avoid those things in your diet so as not to challenge that muscle and see if we get an effect. And over 85% of people that actually have this problem don't need anything further than dietary modification.
Oh, wow.
So most people are suffering in silence. They're suffering without the knowledge of that all you simply have to do is maybe talk to your doctor, give you a couple tips on your diet. Another thing that we might ask that you do with your diet is to add in a fiber supplement.
Okay.
So something like Metamucil or Benefiber. A lot of people are very familiar with fiber supplements. People might say, though, wait a second, you're going to ask me to do a fiber supplement. I don't want to go to the restroom anymore. Is this going to make me go to the restroom more and have more accidents? And that's not the purpose of the fiber. You'll take it with less water under the advice of a doctor. They'll advise you to take it with the proper amount of water, in which case it'll help bulk the stool. And by bulking the stool, it's less likely to have an accident or slide out and have issues. So those two simple measures alone take care of 85% of patients.
So it's really about diet for the most part. But let's say it wasn't diet. Non-surgical therapies, what would they be?
So there are a lot of options. So if you're in the unfortunate group of 15% that those things don't work, right, then there are other things that we can do. One of the most effective things that we can do is pelvic floor physical therapy. Just like if you were to hurt your shoulder and have a rotator cuff injury, the doctor would say, okay, maybe you need to do physical therapy. We have special physical therapists for the pelvic floor that can work with you to get those muscles stronger again. And oftentimes we actually forget how to use those muscles because we don't really spend a lot of time thinking how to use those muscles. We just go. And with the assistance of a physical therapist, they can help you recruit those muscles and actually bulk those muscles up. Another option would be what's called biofeedback, where similar with a physical therapist, we can actually show you on a computer screen how effective your squeeze is, how effective your muscles are working properly. Other options could be bulking the sphincter complex with a small injectable solution that adds greater bulk to the area so it gets a better close. So those are some very common non-surgical options that we have that are, again, very effective. 85% get better with the diet. Of those 15%, probably about half of them get better with just those alone.
Right, right. You know, I wanted to show this a little bit. Maybe you can walk us through this. And let's see.
So this is a simple diagram of the colon. So just for everybody's reference point, this here is the end or the terminal portion of the small bowel. The small bowel is responsible for digestion, and that connects to the large bowel, which is seen here and depicted more graphically. So the large bowel is more, particularly on the right side, is responsible for absorbing water, whereas through the top and then off to the left side here, this is more for storage of stool. So the colon itself is something that has very few functions, mostly for water absorption over here, but mostly for storage. But down here, and I think we have a better picture of this in the next slide, down here is where often patients have issues with the control of the bowels because, as I said, the colon's for storage, but in these areas here, the muscles work to try to keep everything in place.
All right, not to mention that, let's bring this over and see.
So this is a very anatomical picture, but I can try to walk you through this as well. Again, this is a graphical representation of a female patient. So we have the colon coming in here, connecting to the rectum. So this is a zoomed-in view of that end portion of the colon. You can see the colon coming in here, and again, you'll remember the colon is responsible for storage, so it stores the stool. The nerves in this area connect to the rectum, and they tell you that there's stool there and it's time to go. And so if there's nerves that are impaired from diabetes or nerve injuries or things of that nature, that sensing will not trigger you to go, and it'll just overflow and come out. So that's in this area here. As you come further down, though, you'll see this column, this picture here. These are representations of the muscle. There's 3 muscles that actually are responsible for the control of your bowels. One on the inside that you're probably not aware of, and then 2 near the end of it. 2 near the end of the rectum or the anus. One that you can control and one that is working all the time. And that one that's working all the time is the one that works while you're sleeping.
Right.
And so I had alluded to this before. This gives you kind of another picture, a graphical representation of the anus here, the muscles on either side. And this is a normal picture. It's circular. It can close very easily, and it can open to accommodate the stool to come out. This one is a picture where a portion of that muscle is missing, and you can see here things are leaking out. And this can be represented as simply as moisture, or it can be represented as stool or soilage of a sanitary pad, or even frank incontinence. And this is a very common finding that we see as a sphincter defect. So there's a defect in the muscle here. Very commonly seen after pregnancy.
Oh, okay. And that's very interesting. I mean, there's definitely the dietary portion of it, and as you mentioned, the 15% that's not. So, Dr. Estrada, when a patient comes to you, what are some of the questions that maybe the patient should be asking their physician? I mean, what are some of the things that you think they should be asking?
I think one of the biggest things is that this is a little bit of a taboo topic. A lot of people don't want to talk about that. They don't want to talk about it with their family. They don't want to talk about it with their doctor. They don't want to talk about it with anybody.
That's why we're talking about it.
Exactly, and that's the most important thing. We're
Right.
creating that dialogue now
Right.
so that there are people out there that are safe and that can help you. There are a lot of options when it comes to that. But one of the things, if you're having any issues down there, that's something that you might want to talk to your doctor about, whether you feel that you're going more frequently or you can't completely evacuate the stool, where you're having to go multiple times, or you're having problems with hygiene where it's very difficult to clean, or you find that you're using a sanitary pad, whereas before you would just leave the house comfortably without any protection. Now you're using a sanitary pad, or you've graduated to a diaper. Those are things that,
Right.
that you probably ought to bring up to your doctor, because there are things that can be done, that can very easily be done to help you.
Absolutely. So, Doctor, for our viewers, I want to just remind them that today with us we have Dr. Joaquin Estrada with the Center for Advanced Care Digestive Health over at Advocate Illinois Masonic Hospital. That he's on that campus at 900 West Nelson. And if you have questions regarding this topic or colon cancer or anything else, please give him a call at area code 773-296-7095. Again, that number is 773-296-7095. So, like I tell many of the people that we educate in community for any disease state, or if you're questioning what is it that's wrong with me, what is it the questions that I need to ask my doctor, I always tell them, write them down.
Yeah.
Because we always tend to forget once we get there, don't we?
Yeah, you get on the spot, and then all of
Right.
a sudden you're like, I had something I wanted to tell you, and then before you know it, the doctor's out. And so a prepared patient is probably going to get more out of that visit than somebody that's trying to do it on the cuff, on the
Right,
fly. So
right.
definitely, it's always welcome in my office. If you have questions, write it down, and I'll often take those questions and we'll go through it line by line to make sure that we address all of them.
Absolutely. So, Dr. Estrada, I know I'm going to go off topic just for a quick second, and I know I'm very excited because we are in the process of putting together, and again, thank you for this as well, because we couldn't do this without you. But I want to see if you can talk a little bit about what we're doing with this colon fair that we're doing, and obviously it's related to colon cancer.
Yes, absolutely. So as a colorectal surgeon, I touch a lot of different fields, and one of which is colorectal cancer. Colorectal cancer is very common. It's the second leading cause of cancer deaths in America, and it doesn't have to be that way. It doesn't have to be that way because we can prevent colon cancer. It's a very easy way to prevent it. It doesn't necessarily have to be a colonoscopy. While the colonoscopy is the best test, there's some drawbacks to a colonoscopy. Maybe it's the cost, maybe it's the prep. And so partnering with you, we've actually set up a colon fair, a screening fair, where we're going to be able to work with you and your staff to offer screening modalities.
Let's bring that back up.
Yeah, please do. Screening modalities for cholesterol, blood pressure, the BMI, and then not only that, stool tests for colorectal cancer. And so that's something that we'll be giving away for age-appropriate patients, the patients that actually do need to be screened. We'll be giving away free FIT tests so that they can be screened for this preventable cancer.
Right. And I think what's very exciting too is that day we are going to have Ask the Doctor's booth as well.
Yeah.
And we'll be providing we'll be providing 3 languages, English, Spanish, and Polish for the Polish-speaking visitors who will be visiting, and our Spanish-speaking visitors who'll come. Obviously, take advantage of the fair. It's coming up, and we really would hope that everyone takes advantage of this. Sponsored by Advocate Illinois Masonic Hospital, Digestive Health at Masonic. And this, again, is scheduled it's coming up on Saturday, May 20th at Illinois Masonic Hospital from 10 to 2. And come on in, please. Join us. Bring family, friends, anyone who might be at risk. Ask the questions. Prevent, treat, and survive. And this is what we keep saying. Prevent, treat, and survive.
You know what the best part about this is? It's free.
And it's free. Absolutely.
It's absolutely free, so you really have nothing to lose. You can get if there's any questions whatsoever. Doesn't even have to be related to colorectal cancer. If you have questions, there's going to be doctors there that can help you.
Right, absolutely. And lots of resource and other information that will be available to you as well. So, doctor, on that note, you mentioned that you are a colorectal surgeon.
That's right.
What exactly is a colorectal surgeon?
So yeah, that's probably the second most common question that I get.
Okay.
The most common is, why did I ever choose to go into this field? And we'll need a whole nother segment to
talk about
that. But
aside from the shortage. But.
yeah, exactly. No, but a colorectal surgeon is a surgeon that does additional training beyond general surgery.
Mm-hmm.
So a colorectal surgeon is somebody that goes to medical school, a traditional 4-year medical school. They then do residency, which is additional training in general surgery.
Mm-hmm.
That's usually a 5 to 7 year fellowship, 5 to 7 year training program, and then colorectal surgeons do an additional year above and beyond that specialize specifically in the treatment of diseases that are related to the colon, the rectum, and the anus.
Okay, that's a lot of schooling.
It is a lot of schooling.
So, doctor, if you can give a message to our viewers, especially regarding incontinence or even colorectal cancer, what message would you like to leave them with?
So I think there's really no, when it comes to incontinence, there's really no reason that you have to suffer in silence. There are a lot of good options out there. There's a lot of resources, and really the most important thing is to create that dialogue with your doctor. A lot of times the doctor doesn't even want to bring that up because they're uncomfortable, but the onus is on you. You can bring that to your doctor, and the doctor will plug you into the right people to help you. When it comes to colorectal cancer is something that we can prevent and we can cure, and it can be done very easily. Nobody else needs to die from colorectal cancer. This is something that we can prevent.
And most importantly, those colonoscopies are covered by insurance.
Yeah, so colonoscopy, a traditional screening colonoscopy is covered by your insurance because it's a preventative measure. It's like a wellness visit to your doctor's office.
Mm-hmm.
And this is something that is covered. Patients that need to be screened for colonoscopies are patients over the age of 50, patients with a family history. Those are the two biggest groups. And then any patient that is having symptoms, whether it be blood, abdominal pain, or weight loss, those patients really ought to talk to their doctors as well to see if they need a colonoscopy.
And that's why this colon fair that's coming up again, I have to mention it again because it is so important. Again, the colon fair that's coming up at Advocate, Illinois Masonic Hospital, Saturday, May 20th from 10 a.m. to 2 p.m. And free screenings will be available. Ask the doctor, his booth will be available, languages both. 3 languages actually, English, Spanish, and Polish would be available. Again, prevent, treat, and survive. This is something that no one has to die for, especially when it's preventable.
Yeah.
Absolutely.
And I want to say one more time, it's free.
It's free.
It's free.
Absolutely.
It's free, and maybe we'll give some giveaways there as well.
Absolutely. But a lot of resource will be available for you as well. So on that note, our time here goes by quickly.
Yeah.
So Dr. Estrada, thank you again for being on the show, and we really would love to have you come back and keep the conversation going. We can never speak enough about it, and with some other wonderful topics as well. So fecal incontinence can be a debilitating condition, and it has a wide variety of causes and symptoms. The many techniques to treat incontinence include both non-surgical and surgical therapies. It's a thorough discussion with a physician that should be needed, could be evaluated, and it's definitely something that therapies are available for. So on behalf of my colleagues at Advocate Illinois Masonic Medical Center, Dr. Estrada, thank you again for being with us. And thank you for Ken TV Cable 21, allowing us and giving us this venue to come out and to share with you such important information. So until next time, my name is Lucy Aquino with Hispanocare of Advocate Illinois Masonic Medical Center. We'll see you soon. Stay tuned for more exciting, more information coming your way.